If you're missing most or all of your teeth, or you're already wearing dentures, kind of like these, but aren't happy with them, you've probably come across two very different implant options when you're doing your research, right? Snap-in dentures, like this, and then fixed implant teeth, like these, sometimes called all-on-4, all-on-X, teeth in a day. And honestly, the names can get confusing pretty fast because both options, they use dental implants, but they are not the same thing. So in this video, I'm going to break it down for you. I'm going to break down the real difference between snap-in dentures and fixed implant teeth, who each one may be best for, and what you should actually be thinking about before choosing one. My name is Dr. Chris Bano, and I'm a dentist here at Centerville Family Dentistry and Implant Center. At our office, we focus heavily on dental implants, from single implants to full mouth solutions, just like these, all-on-4, all-on-X teeth. And one of the most common questions that patients ask us is this: do I need fixed all-on-X, all-on-4 teeth, or would snap-in dentures be enough? So let's talk about it. This is what this video is about. Now, when it comes to a snap-in denture, it's exactly what it sounds, right? It snaps in. It's a denture that snaps onto implants, like buttons on a jacket. Usually this is done with about 2 to 4 implants like this one. And the reason people like this option is because it gives a denture more stability. So instead of a denture like this one, just floating around in there and lifting up when you talk or when you chew, the implants help hold it in. And this can be a huge improvement compared to a traditional denture, especially for people who already wear dentures and are tired of them moving around. But here's the important part. A snap-in denture still means that it comes in and out. You still have to remove it at night. You still have acrylic material, and it usually still has more bulk compared to the fixed implant teeth. So to sum it up, it's better than a regular denture, but it's not the same as having the fixed implant teeth. Now, when it comes to the fixed implant teeth, like the all-on-4 or all-on-X, these are different. With this option, we typically place 2 to 4 to 6 implants. This, for example, has 6 implants, and those implants support a full set of teeth that are fixed in place. They don't snap in or out. You don't take them out at night. So for people, this feels much closer to having real teeth. You can smile, talk, chew, live your life without thinking or worrying about your teeth moving around. Now, when it comes to the differences, sometimes people think the difference between the two solutions is just like the number of implants. Oh, a snap-on denture uses 2 implants and all-on-4 uses 4. It's not like that at all. That is just the number. But the whole design matters, so let me explain. With fixed teeth, the implants are placed in a way that allows us to support a full arch of teeth that doesn't move and stays in your mouth 24/7. With snap-in dentures, the goal is to usually make a denture more stable, and that is the big difference. So let's talk about who might be a better fit for each option, okay? If you already wear dentures and your biggest problem is that it moves around, a snap-in denture may be a nice upgrade for you. It can make eating and talking more easier. It can help the denture feel more secure. But there are other limitations when it comes to snap-in dentures, which I'll explain in a little bit near the end of the video. Now, if you're someone who still has some teeth left and is trying to avoid ever living with a loose denture, or you want the closest thing to a full set of natural teeth, then fixed implant teeth are usually the better option for you, because we can remove the unhealthy teeth, place the implants in, and in many cases give you fixed temporary teeth the same day. So you're not making a huge emotional and functional transition from having teeth to having a loose denture. You're going to have fixed temporary teeth in place the same day. Another thing to consider with snap-in dentures, if you're leaning towards them, is that when it comes to the upper jaw or upper row of teeth, this is something a lot of patients don't realize, but the upper dentures are usually bulkier. They look like a regular denture and they cover the roof of your mouth, especially if you want them strong. And that can affect taste, it can affect speech, it can make the denture feel bigger than people expect. With fixed implant teeth, we remove the palate. There's no palate coverage, so the teeth feel less bulky and they're sleeker. You don't have that big piece of acrylic covering the roof of your mouth. And for many patients, that alone is a major reason they prefer the fixed option. Another big difference is the chewing strength. What do I mean by that? With the traditional denture and even snap-in dentures, your chewing force is much less than natural teeth. That's why a lot of people with dentures slowly start avoiding certain foods, like steaks, nuts, crunchy vegetables, sandwiches, apples, corn on the cob, whatever. They don't realize or often realize how much their diet has changed until we start talking about it. Fixed implant teeth, on the other hand, are usually much stronger, much more stable because the teeth are anchored in place and they're not coming in and out. That's why patients who choose the fixed implant teeth option, they feel more confident with a wide variety of foods. They want to eat normally again, and they want to go to a restaurant and not study the menu based on what their teeth can handle. Now, let's talk about the materials. A lot of snap-in dentures are made out of acrylic. That material can work well, but can also wear or stain or fracture over time. With fixed implant teeth, the material is made from zirconia. Zirconia is very strong, it's very durable, and can look beautiful when it's designed properly. And that's one of the reasons fixed implant teeth tend to feel more like a long-term solution. And the maintenance. The maintenance is another thing people should understand. With snap-in dentures, there are little parts on those buttons on the inside that help the denture snap into place. And over time, those parts, they wear out, they're rubber. So you may need more maintenance visits to replace them, and then you pay more money, and the denture continues to snap in better as you do the maintenance, but keep that in mind. Now, here's when patients also get stuck. They often ask, which one is better? Which is the better option? If we're talking about the option that feels more natural, the option with less bulk, the option that doesn't come in and out, the option that most closely resembles natural teeth, it's these ones. And that's why I personally prefer all-on-4, all-on-X patients for a lot of my full mouth cases when a patient is a good candidate. Because after doing hundreds and hundreds of these cases, I've seen what a difference it can make when someone goes from struggling with failing teeth or dentures to having fixed teeth that let them smile, let them eat, and function with confidence again. So if you're considering snap-in dentures or fixed implant teeth, here's a simple way to think about it. Snap-in dentures are a more stable version of a denture. Fixed implant teeth are designed to replace the denture experience as much as possible. Snap-in dentures, they come in and out. Fixed teeth, they stay in. Snap-in dentures usually have acrylic and bulk. Fixed teeth are usually thinner and more natural feeling. Snap-in dentures can be more affordable, not always, and fixed teeth usually give you more strength, stability, and confidence. At our office, we're going to walk you through all of this, step by step by step. We take a 3D scan that goes around your head, we look at your bone, we'll look at your smile, and we'll talk you through what you're going to be able to eat, how you want your teeth to feel, what you're hoping to avoid, and what kind of solution actually fits your lifestyle and your goals. Because this decision should not be made based on a random term that you saw online, right? It should be made based on your mouth, your goals, and a plan that makes sense for the long term. So if you've been thinking about dental implants, or you're tired of dealing with loose dentures, the next step is simple, okay? Reach out to our office, we'll take a look, we're gonna answer your questions, we're gonna show you what options actually make sense for you. And even if you're just exploring right now, that's completely fine too. Come on in. We're gonna at least provide you with some clarity on your journey of research. Until then, we'll see you in the next one.